Dr. Jordan Shlain, founder and managing partner at Private Medical. Thank you for being on the podcast today.
It's good to be here.
So I guess first off, tell us about Private Medical.
So Private Medical is a family office for health and medicine with the premise of how do you organize people, data, and technology around a single principle of how do you get the best outcome the fastest. So it's really, you have to know what their biological data is, how they interact with the world, and what their portfolio of metabolic and cardiovascular and genetic things are, so that you can actually package someone up. And because we take care of families, adults, kids, parents, you get an entirely different set of insights than if you just took care of an individual. I mean, we had one story where the kids said to their pediatrician, yeah, we don't really know our dad. He travels too much. So the wife then told my partner that my husband and my kids don't really know each other. So then it got over to me, and so I sat the guy down and I said, so how's it going? He goes, oh, it's great. I'm a CEO of a big company. I'm flying around the world and doing all sorts of fun, crazy stuff, building my business. I said, how are the kids? He goes, oh, they're great. I'm like, yeah? I said, I have on good authority that they don't really know who you are. And they're 10 and 11, and they're about ready to go to high school. And he said, that's patently not true. He was offended and kind of got up, looked, kind of like his dander got up. He said, doctor, why are we talking about my relationship with my kids? You're my internal medicine doctor. I said, well, look, I mean, I didn't mean to offend you, but I think it's worth taking a look down there and talk to your kids. And they go off to college and they didn't get to know you. You don't get another bite at that apple because they're gone. And so he came back a few weeks later for some follow-up visit. And he said, hey, doc, I talked to my kids and they said exactly what you said to me. I said, I think you need to quit your job. 6 months later, it was a publicly traded company. It was a big, big company. He quit his job. Now he's got a great relationship with his kids 10 years later, and he sent them off to college. He visits them all the time. And so I want to bring a creativity and imagination, and if I had no constraints, what would I build and how would I build it? And what resources would the doctors have? What resources would our members have? We don't even call them patients because they're not sick. They're members. When they're sick, we'll refer to them as patients, but we don't. But even the language matters. So we have lots of different language that we use that really tries to honor people in their lives and not kind of medicalize them.